Being diagnosed with a chronic condition or non-communicable disease can leave a person feeling very lost and overwhelmed. Ongoing treatment and making lifestyle changes can also be very frustrating. But now you know how early detection and understanding your condition can make the journey ahead less bumpy and less scary. You're suddenly told your life as you know it has to change if you want to stay alive and healthy. It can be extremely scary and depressing. You go through every day wondering if you're doing it right, taking the medication correctly, eating the right things at the right time. It can be very daunting. But first, you need to understand what a chronic disease is.
Chronic diseases are broadly defined as conditions that last for prolonged periods of time. They usually require ongoing medical treatment. In some instances, they can actually affect one's activities of daily living. And they can be grouped into communicable or non-communicable diseases. Non-communicable diseases are diseases like hypertension, diabetes, or chronic respiratory diseases like asthma or COPD, while a communicable disease, for example, could be HIV. What is important is that, especially in the non-communicable diseases, is that they are responsible for 39% of deaths in South Africa. And what's even more worrying about that is that this occurs, about a third of these deaths occur in people that are under 60 years.
Seeing as non-communicable chronic diseases contribute to a significant number of deaths in the country, let's find out more.
So NCDs are associated with four main risk factors. That's excessive alcohol intake, that's use of tobacco or cigarette smoking as we otherwise know it, physical inactivity, and an unhealthy lifestyle, unhealthy diet. And we know that I think with the convenience food and the fast foods that we have nowadays, there's a rise in obesity, including children, which is a serious concern, as this will later lead on to complications such as diabetes.
Many of us could be living with a chronic disease right now and not even know it until it's too late.
Chronic diseases can be easily treated and detected. So it's very important for people to consult, have regular consultations with their GPs. People can also go for screening tests like BP monitoring, blood glucose testing at your GP's office. There's a lot of pharmacies that have clinics as well where you can actually get these screening tests. And then in terms of treatment, doctors are trained, of course, and there's a treatment that is specific to that condition.
After diagnosis and recommended treatment, the onus is on the patient to take control of their life once they fully understand what is happening to them and their bodies.
These are long-term conditions and they require long-term treatment. So the importance of that is that the disease needs to be managed and it needs to be under control. A lot of diseases like HIV, diabetes, hypertension need ongoing care and ongoing treatment. Not only is medical treatment important, but there are various tests that one would need to undergo in order to just manage the condition better, for the physician or the treating doctor to make sure that the condition is under control.
Some chronic diseases or NCDs are easy to manage if you follow your doctor's advice, are diligent with your treatment, and make the necessary lifestyle changes.
So you need to understand that if you are diagnosed with a chronic condition, you need to take your treatment regularly. You need to adhere to the treatment. You need to go for regular checkups. You need to go for regular blood tests that your doctor would send you to. And you need to make sure that you have a healthy lifestyle and just change. And we call it lifestyle modification. So more physical activity as well as just eating a healthier, balanced diet. But the important thing is that one needs to take charge of their own life and be actively involved in their treatment.
Having a chronic disease or NCD isn't a death sentence. Patients can and do go on to live fairly long and healthy lives. Being diagnosed with a chronic condition or non-communicable disease can leave a person feeling very lost and overwhelmed. Ongoing treatment and making lifestyle changes can also be very frustrating. But now you know how early detection and understanding your condition can make the journey ahead less bumpy and less scary.